all, my name is Shlomit. As you can see, I'm a family physician. I work in Clalit. Clalit is the largest HMO in Israel. I'm the head of the Department of the Family Medicine. This is why I said, Demian, that I'm basically, this is all relevant for you. And I'm deputy to the head of the Community Medical Service Division in the Clalit HMO. I'd like to explain that Clalit has a community division and a hospital division because we have 14 hospitals. So we're divided into two parts, community and a hospital, and I work in the community part, okay? Now, before I begin my lecture, I want to talk a little bit about Israel, about the HMO, about medicine in Israel, so that you get some kind of background about everything. Okay, you know that the population in Israel is about 10,000 people, 9 million, not 10,000, 10 million, 9,700,000. 75% of the people are Jewish, 20 or 25% of the population are Arabs, and we have others who came from other areas and are not necessarily Jewish or Arabs. The infant mortality rate in Israel is really, really good compared to other European or Western countries. You can see in Israel, the number of deaths is 2.8 for every 1,000 lives birth. And if I show you normal European countries, look at the United Kingdom, it's more, it's higher. More babies die every single per 1,000 live births. Look at Canada. Canada is quite high compared to Israel. It's about 5. And let me, hold on. Let me just move this. Hold on. You can see here, I can't see it because this thing is bothering me. You can see that Germany, Netherlands, the United Kingdom, Canada, and the United States, they're all amazing countries, but worse than Israel, okay? So we're quite proud of this thing, that the infant mortality rate is quite low, okay? Also, life expectancy in Israel is quite high. You can see that life expectancy, okay, life expectancy is quite high also compared to Western countries. The average in Israel is 82.9. You know that women live longer than men in Israel, and you know why women live more than men? Because God gives us a few years to not take care of you guys, okay? He's giving us some freedom to be all alone. We have 4 HMOs, as I said before. Clalit, which basically has half of the population in Israel. We have more than 5 million patients or customers, whatever you want to call it. Maccabi, the second largest, has half of what we have. Meuchedet has half of what Maccabi has, and Shlomit has half of what Meuchedet has. So basically, the biggest HMO is the Clalit, which is where I'm working. Now, you can see that Clalit has 9 districts, okay, from the north of Israel until the south of Israel. Okay, we have, you can see the number of patients we have in every district. And as I said before, we also have 14 hospitals from top to bottom everywhere. We have a hospital in Eilat and we have a hospital in the north of Israel. So everywhere we have hospitals and clinics. We are in the entire country. Beseder? Now, I'm very, very proud because, as I said before, I'm a family physician, and I'm very proud to say that Clalit has the highest family physician specialists, not GPs, not general practitioners, but doctors who became specialists in family medicine. 41% of the patients, 41% of the doctors that work in the community are family physicians. 9% are internal medicine. So for me, it's the same. I don't care really if you become a specialist in internal medicine or in family physicians. And 9% have an internship in other fields like neurology, like geriatrics. So altogether, we have about 60% of the doctors that are specialists. Compared to other HMOs, this is a very, very good situation for us. Okay. What is the job of the family physician in the Clalit? Well, the first thing is, of course, to control chronic diseases, okay? Diabetes, hypertension, cardiovascular diseases, asthma, COPD, hyperlipidemia, and so on. The second job that we have is to treat acute illnesses, upper respiratory tract infections, UTIs, urinary tract infections, and so on. And of course, we have to deal with preventive medicine, occult blood in stool, mammographies, things like that. Okay, so how do we know what do we have to do? Okay, we have a set of quality indicators. You can see I divided it into 3 groups. One indicator is to see if the doctor controls the disease in a good way. The diabetes, is the disease controlled? Hypertension, is the patient hypertensive or normotensive? Cardiovascular disease, does he have any, sorry, I don't know why this is happening. Rachel, one of you is moving the things here. Mayan? Okay. Asthma, COPD, hyperlipidemia. We want to make sure that the patient, all the diseases are under control. The second thing is the preventive medicine. We want to make sure that in the future our patients won't have any diseases. So I want to make sure that all women age 50 and higher do their mammographies. All men and women 50 and higher do the occult blood in stool or colonoscopy. I don't care what they do. I want to make sure they get their flu shots, their pneumovax shot, that they're not obese, that they stop smoking, and so on. And also, we have another set of indicators, which is the documentation of parameters, like what's your height, what's your weight, are you smoking, what is the blood pressure, what are the values of the FEV1, the forced expiratory volume in a spirometry for patients who have COPD or asthma. Are you doing exercise, because it's very important for you, and obviously all the blood tests to see if you have anemia and so on. So the follow-up that's basically required after patients who have chronic diseases, I'll take an example, diabetes mellitus, we want to make sure that the glycosylated hemoglobin A1C is normal, obviously according to age and other diseases that the patient have. We want to make sure that the fasting glucose level is normal, that the LDL level is very low because this man is diabetic, that the blood pressure is under control, that he doesn't have any retinopathy, so he has to see an ophthalmologist, and obviously ulcers or just a foot examination to reduce the risk of amputations. The hyperlipidemia, we want to see what the LDL level is. And of course, it goes according to risk factors, because if I'm young and healthy and I exercise and everything is okay, I can have my LDL level even up to 160. But if I'm diabetic or I have hypertension or I'm fat or I'm smoking and I have other comorbidities, obviously LDL has to be below 70. So it all depends how old you are and what the other comorbidities are. Now, what we do is I told you that we have the set of indicators. And with these indicators, we can actually see if the doctor is doing a good job or is not doing a good job. But the problem is that a doctor who has a good indicator score doesn't mean for sure that he's a good doctor, okay? Because obviously there are other factors that we need in a doctor, okay? The support he gives patients, the aid he gives them, the attitude he gives them, okay? But I cannot measure these things. So I simply take the set of indicators that I can check in order to see that the doctor is doing a good job in controlling those diseases. Now, we have about 75 indicators. How can I remember all these indicators? How can I remember to do it? So this is a picture of how the clinical patient's file looks. In the morning when I open my computer, this is what I see. I see the patient's name, his age, all the stuff, the diseases that he has, the medications that he takes. And here in the yellow arrow, I can see all the indicators that are missing for this patient. Let me give you an example. If I press on this page, I'm going to have a list here, okay? This patient has 4 indicators that are missing. 1, this patient didn't do a creatinine levels, and he's 40 in the past 5 years, and he's 40 years or more. The second one, he didn't do colonoscopy or occult blood in stool. No one measured his blood pressure, and no one wrote his weight and his height. So we don't know what his BMI measurement is. So basically, I come in the morning, I open the patient's file, and I can see that he has some quality indicators that are missing. I look what I have to do, and I can tell him, listen, I want you to do this blood test. Please take this occult blood in the stool kit and do it at home, and I can measure him for height, weight, and blood pressure. Now, the doctor's daily routine it's very, very amuse. How do you say amuse? There's a lot of things that we have to do, okay? We have to see patients
very busy.
Very busy. We have to see patients between 10 to 12 minutes, every 10. It means that I see basically about 6 or 7, sometimes even 8 patients an hour. That's a lot. During that time, I also have to go over all the blood tests that my patients did to see that everything is okay and I don't have a problem. I have to answer patients' requests. I will show you what they're asking. Generally, they're asking to do blood tests. They're asking for prescriptions. They're asking for sick notes and stuff like that. I have to call patients because obviously if I went over a patient's blood test, then I have to call him if he has anemia or if his cholesterol level is very high, his sugar level is not controlled and stuff. I have to answer phone calls because a lot of patients call you for various reasons. I have to support the nurse because sometimes patients go to the nurse's office and you have to give your opinion on some kind of an ulcer in the leg, ECG that the patient does. So there's a lot of work, really a lot of work. So how can I help the doctor? And this is basically why I did this lecture. I want to show you what the Clalit, how Clalit helps deal with the everyday task, how I can organize the doctor's tasks. Okay, so this, as I said, this is how the patient's file look. On the top here, we have all the patient's problem list. Hypothyroidism, for example, this patient, it's a real patient of mine. She has hypothyroidism, she's obese, she has migraines, she has impaired fasting glucose, and so on and so on. And this is the list of medications that she takes. So it's very, very easy to give her the prescriptions. I simply press on that and the prescription come out. Now I have various a scale, okay, here on my computer. In the morning when I come, this is how it opens, how my computer opens. And I can choose every tab here to see something different. Well, in the first tab here, I can see the medical file. On the second one, I'm actually connected to all the information that the patient has. For example, if he was hospitalized in all the hospitals in Israel, I can see the information. If he went to other doctors, to an orthopedic doctor, to an ophthalmologist, to an endocrinologist, I can see it here. All the blood tests that he's done in his entire life, I can see it here. All the vaccinations that he got, I can see everything. So I call myself the big sister, Ha'ach HaGadol, you know that? Because I can see everything and I know everything about you, okay, about my patients. The third thing is a list that the patient, all the patients that today made an appointment for me. So I don't have a surprise. The door is closed. I have one patient. I can look at the list and I say, oh, I see Rachel is waiting for me today. Good, very good. Or maybe I can say, oh, fuck, Ma'ayan again. I can't deal with her again, okay? So you see the patient's list, okay? Then I also have all the bureaucracy, all the list of the patient's requests.
תיזהרי, את יודעת, אני בכללית, אני יכולה לעבור אלייך בתור רופאה עצמאית.
כן, but Rachel, you're not in Tel Aviv, okay? So it's okay.
אני כן בתל אביב דווקא.
Oh my God, so thank goodness Rachel is here, okay? Thank goodness. Okay, now here in number 4, I see the list of all the patients' requests, because I don't expect Rachel to come every time she needs her prescription renewed. She can actually get into an app, I will talk about it, tell me, hey, I need my prescriptions, and it comes here, up here, I have a message, see here it's 0, but I might have 5, 6, 10 requests, and I simply renew her medication, her prescriptions. She doesn't have to come and see me physically, okay? Also, she can ask me for blood tests. She can ask for a sick note because she didn't come to work today, and so on. I also have here Dynamed. I hope you know what the Dynamed and the up-to-date are. These are the medical information database. I will talk about these. These are very important because you know that as a family physician, I work alone. It's not like I'm in the hospital. I don't have other doctors that I can talk to right now and say, hey, I have some disease that I don't know what to do with it. So this actually gives me information, what the disease is, how to treat it, and what's the follow-up that I have to do for the patient. And last thing is the CPI, which is something that only Clalit has. It's Clalit proactive intervention, and I'm going to talk about it in a few minutes. So imagine a patient enters the doctor's office with a letter from the hospital, and he presents with some kind of a disease or some kind of drug that I never heard about, okay? What can I do? As I said, I'm alone. I can't ask the chief resident. I cannot ask the other doctors that are like in the hospital. I'm all alone in the field. So this is why we have the up-to-date or the Dynamed, okay? These are the places where we have all the medical information, and it's up-to-dated all the time, okay? So if there's a new drug, they will have it already inside. The new drug came yesterday, today it will already be here. So it's very, very good because it's all the medical information that I will need. So let's see. When I was in med school, I learned about rabies, okay, here. Now, I am a doctor 17 years, and I have never seen a case of rabies in my life, okay, because there's no rabies in Israel. But if suddenly there's rabies in Israel, okay, so I have no idea how to treat it because 17 years ago I learned about it, but I don't know anything about it today. So I call Dynamed or I go to the up-to-date and I have information about rabies. Look, here is the Dynamed. This is the Patron Dynamed. This is rabies. And I can look how to manage. What do I have to tell patients about complications and prognosis? What is the diagnosis? What is the treatment? Everything I have to know, I can do it from here. Now, imagine if it comes with a drug that I have never heard because it's a new drug. And you know, every single day we have new drugs and things that I have no idea. So let's take Alcoxia. Alcoxia, you know what it is? It's a non-steroidal anti-inflammatory drug. I love this pill. I take it quite a lot for my backache. But let's assume I don't know anything. So I press this tiny little button, okay? And it enters immediately into the Micromedics. The Micromedics is the book that tells me everything about the drug. What is the dose? How many times a day? Who I give it to? What are the drugs that I'm not allowed to give it with? Can I give it to pregnant women? Can I smoke with it? Can I eat orange juice with it? Can I drink alcohol with it? You get all the information, and you can kidney function if I have to do some kind of a treatment, and so on. So what I'm trying to say is that we have all the information for the doctors. We don't have to be, we're not alone in this case. Okay, now, if the doctor wants the patients to receive information about some kind of a disease, okay, let's assume we have a new patient and he's diabetic, and you give the patient all the information. How much of that information do you think the patient will remember when he comes home? I think he's hysterical. You told him that he has diabetes. You told him that he's probably going to have some kind of amputation, that he's going to have kidney function decreased, that he's going to be blind, and that he's not going to be able to have sex. I promise you that the only thing the patient will remember is that he will be with sexual problems, okay? When he comes home, he has no idea what I told him. So I have the opportunity to send this patient information in very easy language, okay, in very easy Hebrew, not in medical terms, which explains, and it goes through the mail, and it explains to the patient about the disease, about the drugs, about the complications. So, and that's helping the patient read a little bit about the disease, and then he can come and ask me questions. So it's really very good for, you know, if patients know about their disease, it's going to be better controlled. So this thing actually helps me give the patient information, make the patient take responsibility for his disease, and also control his disease. Now, I told you that there are quality indicators that are for documentation. So there are several places in the medical file that we have to document the things. For example, this patient is 175 centimeters high, 82 kilograms weight. The blood pressure is 130/70. And here it's probably a patient with asthma or COPD. And I gave him a spirometry. So the forced vital capacity and the forced expiratory volume are also written. So if I write these measurements, obviously the documentation is well inside the medical file. Okay, you also have everything that I told you, that you have quality indicators for a colonoscopy and mammography and lab results that we need. So everything is organized very, very well in the patient's medical file. And as I told you, you are the big sister. You can see everything the patient has or had in the past. Now, the problem is that we have a lot of data and we cannot remember and we cannot organize everything in our brain, okay? And the older I get, the more difficult it becomes, okay? So how can I basically help this doctor use all the data that he has? This is something that is amazing for us. Only Clalit has it, okay? I want to give an example by giving the diabetes as an example. I have, I don't know if you know, but there are more than 70 drugs for diabetes, okay? Now, I am a doctor, as I said, more than 17 years already, and I do not know all these medications by heart, okay? Because every single day there's a new medication. Now, you know that the first medication that you generally give a patient is if you need insulin, then you give insulin. But if not, you give metformin or glucophage. That's the first treatment. Now, how do you decide what is the second one? Look at this guidelines for the treatment of diabetes. You have all these drugs. You have the first monotherapy, and then you have the second drugs to combine two drugs, and then you have all the combinations possible. As I said, you have more than 70 drugs. Impossible to know what the patient needs, what's good for your patient, which drug is better for him. So here in the Clalit, we have this app, okay, that it's actually a program that helps choose the right drug for the patient. For example, look at the questions here. I'm sorry, I need to move this. Good, look at the patients. Is my patient suffering from postprandial hyperglycemia? If I say yes, it's going to give me the right drug to avoid postprandial hyperglycemia. If the patient has cardiovascular diseases, it's going to give me the best drug that is going to be helpful for prevention of cardiovascular diseases. If my patient has recurrent UTIs, it's going to give me the best drug that won't cause any glucose. There are some drugs that increase the glucose secretion in the urine, and that's what causes the UTIs. So after I write all this, it's actually going to calculate which drug is the best drug for that patient. So obviously, if Ma'ayan is diabetic, she's not going to get the same drug as Rachel if Rachel were diabetic. Each one is going to get her drug that is good for her. So that's called personalized medicine. I give the patient what is good for him and not just any drug. Now imagine a young woman, she takes the contraceptive pills, okay? every month she needs to refill, okay, for her contraception. So instead of coming every month to the doctor's office and waiting for her turn, she simply sends me a message. As I showed you, there's a tab for the messages through her app. She opens her iPhone. Here's my iPhone. I open the Clalit app and I write, doctor, please give me the medications that I need for 4 months. And I received the message. Here I showed you that I received the message here. This is the patient's file. This is how it opens. And here I have 2 messages from my patients. One of them is, hey, doctor, give me please the prescription for my drugs. So everything, I don't have papers on my desk. I don't have a lot of messages coming from everywhere. Everything is organized in this tab, and I simply open it and I do one a task at a time. Okay. Now, the doctor prepares the prescription. Okay, I gave this woman the 4 month pills that she needs. She doesn't have to come and take the paper. She doesn't have to come and take the prescriptions. It's automatically transferred to the pharmacy. Okay, she doesn't have to print. The doctor doesn't have to sign anything. The patient simply goes with her with her cell phone. She gets all the information on the internet. She goes to the pharmacy and she buys it. We do not have to see the patient for things that we do not have to see the patient. If you don't need a physical examination, obviously you don't have to come. Okay. Now, also imagine a very old person sits at home, unable to come to the clinic because his daughter is working and his son is in the United States, and he needs some medical advice. So he can chat with the doctor. If he doesn't need a medical examination, he doesn't have to come to the clinic. He can simply chat with the doctor. So I see my patients in the computer just like I see you guys now, and he sees me, and we can talk to each other, and I can give him all the information he needs. Now, as I said, it's only for patients that don't need physical examination, because if you come with abdominal pain, obviously I need to put my hand on your abdomen. Okay, I need to check you. But if it's talking about diabetes control, smoking, dietary changes, lifestyle modifications, insulin titration, 50-60% of our visits can be through the video and through phone calls, and I don't have to see the patient physically in my clinic. Okay, so it's very helpful. Now, we have something even more incredible, and that's called the title. Okay, a 2-year-old boy wakes up in the middle of the night with fever, and he has an earache. And his parents have this machine that's called Title. Look at this machine, okay? It's a machine that contains a camera, an amplifier, a tongue depressor. Here is the tongue depressor. A stethoscope. Here is basically a stethoscope. We also have a ear speculum, so you can check the ear. And what you do is the parent uses the device to check the ears, the pharynx, the heartbeat, the lungs. And because it's connected to a camera and to an amplifier, a microphone, so the picture or the information is actually transferred to my computer. So I can actually see the ear drum, and I can see the pharynx that the doctor checked. So even if I need a physical examination or I need to listen to his breathing sounds, I don't necessarily have to see the patient in my clinic. I simply need to use the parent or someone in the house to help me set the device. And that's amazing. And all Kupot Cholim, all the HMOs have it today. It's something that was made in Clalit, but everyone bought it because it's so amazing. By the way, we used it during the Corona period where people couldn't get out of the house, but they needed to get a medical examination. So this is why we started it. Now,
Shlomit, we have a small question, which is important before you go on, please. Are there information in English in the medical app as was shown for drugs and disease?
everything is in English in the medical application, or in Russian, or in Arabic, or in Hebrew. You can choose what you want to do.
Amazing.
Also, we have a call center, star 2700. You choose at the beginning, they say, hello, this is Clalit. To choose Hebrew, press 1. To choose Russian, press 2. Lugat al-Arabiya, which is the Arabic language. That's the only word I know in Arabic, because I call the call center a lot. Press 3, and you also have English. Okay, so no problem. English is not a problem in Clalit. By the way, a lot of doctors write everything inside in English. You should know, okay? I see sometimes patients that I referred to neurologists, endocrinologists, they answer in Hebrew, in English, okay? That's not a problem. Okay, we also have Doctor Online. Think about it. At 7 o'clock in the evening, when I closed my clinic, if you need information or help at 8 o'clock, you need a doctor's assistant, you can simply call the doctor for advice. So you call this, we have every HMO has a number. Our number for everything is star 2700. We can call and ask to talk to a pediatrician, a internalist or family physician, or a dermatologist. And the good thing about it is that to make an appointment for a dermatologist, sometimes it's maybe 3 or 4 months. So you can simply see the dermatologist, show him, here, I'm showing you what I have on my skin. And he says, yes, why don't you take Dermacombid for 5 days and everything will be all right. So it's really, really good. They can give prescriptions. They can give you referrals to the hospital. They can give you a blood test, everything. Okay. So as I said, the call center is 24/7. You can also talk to a nurse. Sometimes there are things that nurses, most of the time, there are things that nurses can solve very, very easily. And also you can make appointments either through the phone or through the application, whatever you want. Okay, now a little bit about, here I spoke about patients and stuff like that. Now I want to talk a little bit about the information for doctors, because as I said before, we are all alone in the clinic and it's very, very scary. Okay, now doctors have a lot of information. Sorry,
small question. Lev is asking, how do patients get a Taito device? Do they rent or buy it?
They buy it. It's very, very cheap now. It was very, very expensive, about 1,000 shekel at the beginning, but now it's something like 250 shekels. And last holiday, the Clalit gave all the workers, a doctor, the CEO or the cleaning lady, they gave everyone a gift for the holiday or for the doctor's day or whatever. We have Taito in the house. Okay, I gave mine to my little brother because he has 4 little kids, and I felt sorry for him, and I don't want him to call me anymore with his problems. So I told him, take the Taito and call by yourself. Don't call me in the middle of the night. Okay, I'm an amazing sister, amazing. Okay,
thank you. Thank you.
Good. Okay, so by the way, you can buy it today as a patient, and you can get it as a doctor or buy it as a doctor. I don't know what today we do, and it's really, really great. Okay. All right. Okay, so now for the patients, you know, the amount of information that we have to read every day to stay informed is huge. Every single day, there are new articles and new medications, and there's no time to read everything, okay? No one can read. Even if you sit from morning to evening, you cannot read all the new information. So what we do here in Clalit is actually we use the poems, the patient-oriented evidence that matters. What we do here, this is in Hebrew, but I'll tell you exactly what it means. It means that every month we send our doctors translations of articles, and the articles are sent to my mail. Okay, so when I open my mailbox in the morning, I have a mail from the management, and they show me a translation of very important articles that I think are important for my everyday work. Obviously, I'm not going to talk to you about some kind of new neurosurgical procedure for whatever, but I'm going to talk to you about things that are relevant for my everyday clinic, okay? I also tell you how long it's going to take you to read the article because you don't have time. So I'm telling you, hey, put aside 2 minutes to read this in Hebrew. What is the level of evidence? How good this, how strong the evidence is, and what is the source? Let me give you an example. You have here an article, and the article talks about SGLT2s, that's a medication for diabetes, in primary and secondary prevention of heart disease and kidney damage in patients with diabetes type 2. Now, it takes 2 minutes to read the Hebrew summary, 2 minutes. Here is the sentence that summarizes everything. Yes, you should give a patient SGLT2 in order to decrease heart disease and kidney damage, okay? This is, if you don't have the 2 minutes, you can just read this one sentence that gives you the summary of the entire paper. And here the level of evidence, 1A is the best level of evidence we have, okay? It means that the controls and all the things that they did here is really, really good, okay? It's very, very good evidence. So we send our doctors every month 2 articles, at least 2 articles of things that are relevant. How do I decide if it's relevant or not? I send them news flashes about issues that are relevant and in focus. I'll give you an example. You know that the WHO wants to eradicate the hepatitis C disease by 2030. Why? Because today we have medications that if you take them 8 to 12 weeks, you kill the virus. So the patient doesn't have the disease anymore, okay? You cure the patient. So we have to take all these patients and treat them. For this, I need to teach my doctors how to treat the patients, what follow-up they need, what tests they have to give, and so on. So I give them the articles and the information that has to do with the hepatitis C. Or, for example, NOAC treatment for atrial fibrillation. In the past, we gave warfarin, Coumadin treatment, which is a terrible drug because you have to take blood tests every week and you have to set the level of the drug according to the levels, and you're not allowed to eat green vegetables and so on. Today, we have the NOACs, the Eliquis, the Pradaxa. You don't have to do anything. The patient can take it freely, and it's so I need to educate my doctors about the new medications and the new procedures and everything that is important for the everyday doctor. So we give this information to make sure the doctors are up to date with all this information. Now, we also have the I study. I for the internet, for the information. Doctors don't have to go to the university to study anymore. They can simply go in the evening to the courses, just like we're doing now, through the Zoom or the Teams or whatever, and listen to a wide variety of courses in various fields, whatever they want, whatever they need, and they can simply study in the courses that are online. Now, also imagine that a very old patient arrives to my clinic and he has some kind of a medical problem. I gave an example of a nephrological problem, okay, like a constant increase in creatinine levels, and I do everything that I can and I cannot find the reason. Obviously, I need some nephrologist to give me a consultation, but the next appointment is in 3 months. So what can I do? I can simply write all the information on a referral. I can write the medical examination, tell the doctor what tests I did, the ultrasound I did and everything, and send it online for the nephrologist. And within 48 hours, without seeing the patient, the nephrologist can enter the patient's file and get all the information he needs and give me the advice that I need to do. Give him this drug, send him to this test, and so on and so on. So everything is really quick. You don't have to wait 3 months for the next doctor. It's really, really great. Now, just 1 or 2 more things that I want to talk, what's next. It's already working. We have CPI, which is a short for Klalit Proactive Intervention. It's a tool that helps us treat patients as a group. For example, all patients with hepatitis C, I can see a list of all the patients I have with hepatitis C. And by entering their medical file, when I press enter, they receive a message at home, a text message. Doctor sent you some messages about tests that you have to take or an appointment that you have to make, or patients that have a high risk for a fracture of the hip. Maybe I forgot that in the past this woman had osteoporosis, or she fell and she broke her arm or something, and I didn't realize that I didn't do the connection. I didn't connect the dots that this woman is at risk for a fracture of the hip. So this program actually takes all the information from the medical files and tells me, listen, Shlomit, this 70-year-old patient had 2 fractures already. She's osteoporotic. She doesn't buy the medications you give her. Why don't you give her a call and ask her to come and talk to her about fractures and so on? So we have this about a lot of diseases. We send our patient to relevant tests in one click, and all the information is automatically transferred into the medical file, and also the patient received a text message informing him you should do these and these tests because your doctor wants it, okay? And this is how it looks. I have a list of patients, which obviously I am not showing you. And here this patient has diabetes, and I did not send him to an ophthalmologist, nephrologist, endocrinologist, and so on, and he's not controlled. Or here is an oncological patient that should receive a drug, but she didn't buy any of the drugs in the past 3 months. So it's an alert for me to call her and say, listen, call this patient. It's life-threatening that she's not taking this medication. So it's really great for the doctor. We also have a digital urine test. If you are pregnant or you have recurrent urinary tract infections, you can buy this for 20, 30 shekels in the super farm, in the pharmacy. You take a urine test at home and it's transferred to the doctor's computer. So if you do it at your home, the application is connected to my file, my medical file. So if, for example, you have something in a Friday afternoon and you have symptoms, hematuria, you go frequently to the bathroom and so on, you can go buy it and I will already receive all the results and I can give you online antibiotics. And one last thing is the voice recognition that I want to talk to you. I think it's very relevant for you guys because Hebrew is not your first language. You can, instead of typing very, very slowly all the information about the patient, you can simply record it. And it enters the file beautifully. And by the way, a lot of people have various accents. So, for example, a lot of Russians, they changed the H with G. Instead of saying inhalation, they say ingalation. It still understands it, okay? The computer learned all the different dialects that patients have and barely any mistakes. So it's really great. And I think it can help a lot of Rofim Olim that come from various states.
That's amazing. I didn't know about it.
I know, instead of inhalatia, they say ingelatia, and it's simply amazing. We're using it now with doctors in the Röntgen. We're using it with the Klinayotic Shoret, speech therapists, because they speak quite clearly, obviously, so it works really well. And guys, there is so much more, okay? Amazing things. I'm really proud to be a family physician today in Clalit, because I think we're very, very into the 22nd century, okay? Not the 21st, the 22nd century. And it's just becoming better, okay? So first of all, thank you. I will answer questions if you guys have. Yes, and come to Clalit, okay? As you can see, something very good is that because we are a very big HMO and we are from north to south, if today you decide to live in Herzliya and tomorrow you decide to live in Ramat HaGolan, you still have a job, okay? Because we have clinics all over Israel, okay?
I have a question here from Georgie. You stated that the average time per patient is only 10 to 12 minutes. Is this true only for family doctors or for everyone, like, for example, psychiatrists, for example, or other professions?
No, family physicians generally every 10 minutes you have a patient and you have 10 minutes. I call it a break. It's not really a break. It's simply so that if someone comes without an appointment, you can put him inside. So basically, you see patients about 6 patients, sometimes even more, because you know the Israelis, we don't have any. We have a lot of chutzpah, and we come without making an appointment. Sometimes for children, for pediatricians, it's even less. It's 5 minutes for every patient, okay? Because they don't have chronic diseases. They have generally a little bit of runny nose and fever, so it's 2 seconds to check the little boy. Obviously, about 10-20% of the children have chronic diseases, so you need a little bit more time. A psychiatrist, of course, they have more time. I think something like half an hour or more. Dermatologists have something like 2 minutes, okay? Because they don't even need to look at you. They say, oh, you take this cream. Oh, you take that cream. So it all depends on how. And by the way, saying that it's 10 minutes doesn't actually, I work 2.5 hours on a Sunday, which basically means I can see 18 patients. I think I generally see 25. Okay, so it changes, it varies. Okay, so yes, we work really hard.
Guys, if you have questions, just open your mic, and we are a small group.
You know, when we say that the Israeli medical system is too efficient, I think Shlomit explains to you.
I will explain something. I have a friend. She works in the in a Balitzer's department. Professor Balitzer is the head of the new, an amazing guy. And she went now to the United States to do some research in Harvard. And she has a son that is quite ill, okay? He has a chronic disease. She said it took her 3 months to go to see a GP, okay? I'm not even talking about the neurologist or anyone else. 3 months to see the GP. This will never happen in Israel, never. Because if you have an appointment in 3 months, you will come tomorrow to the doctor, okay? Without an appointment. As I explained, the Israeli system is very different. We have an excellent medical system. Excellent medical system.
Thank you for your presentation. It was really nice. So I would also like to ask the question about what it is in that case for doctors who are working like in the special centers which are open at night. They not belong to Clalit, or they not really belong to Leumit or something else. Many people from different
HMOs arrive there. Yeah,
they find there. So what kind of
this is the night clinics that we have. They are private, but the HMO gives referrals there, because we prefer that you will go to that private clinic instead of going to the hospital. Because if I refer you to the hospital, it costs me, Clalit, about 1,200 shekels. Whereas if you go to the Terem Bikur Rofe, that's how it's called, it costs me about 80 or 90 shekels. And you have their doctors, you have a Röntgen, you have blood test, you have a nurse, and generally you go when you need something acute. For example, if you're a man and your throat hurts, obviously you cannot wait to the morning, okay? So you need to see a doctor right now, because you're going to die if you don't. So young men with a throat pain go to the Bikur Rofe. Or if you fall and you open your chin, like for me, I took my 85-year-old father who fell on the street when he came back from synagogue and opened his chin. So I went there for stitches. But it's not to get it's not for chronic diseases. It's if you need something right now at 8 o'clock at night, okay? Mostly the doctors there are not specialists, and they give you the acute treatment that you need right now. You have pneumonia, I will give you antibiotics. You have pharyngitis, I will give you antibiotics. Urinary tract infection, I will give you antibiotics. You opened your chin, I will stitch and give you tetanus, but nothing more than that, okay? That's what they do.
You know, Lev, that the same term that we mentioned, each MHO have also their night clinic. I don't know, like in Maccabi, you have Netzach. In Clalit, I'm sure they have also. I don't know the names. So this is the same idea. Okay, I went there 2 weeks ago. My son fell down. He has a screw in his leg. He said it's nothing. I said no, I don't think so. We went. They did stitches, and that's it. So that happened also in all the 4 Kupat Cholim. Okay,
yes,
so
my son is a judoka,
yes.
and once during the competition, he fell on his hand, and I was afraid that he broke his hand. I went to that place, they made an x-ray, and thank God it was not a fracture. So this is something you do when it's an acute situation. They don't solve all, they don't control all your diseases, they don't refer you to all those places. It's something that the HMO uses because we need to give patients 24/7 medical attention.
So they
Can
do not
you-
have sorry. So they do not have an access to your system. For example, if I'm from Clalit, I go to Bikur Rofe or another like Terem, and then they cannot access the same program as you do access.
No, but Bikur Rofe or Terem, they have whatever they wrote, it comes into my, if I have a deal with them, a contract with them, what they wrote enters my medical file. So if my father went to get his chin stitched, his doctor will see it the next day that my father went there, and he will see what happened. Yes. I told you I'm the big sister. Okay, I see everything. Okay.
All right. Thank you.
By the way, Lev, I can also see if the patient bought medications or not, because sometimes the patient comes and I see that his diabetes is not under control, and I'm thinking of giving him a second drug, okay? But then I look in the side and I see that he didn't buy his medications, and I understand that I don't need to talk to him about the second medication. I need to talk to him about buying the first medication, okay? So seriously, I can know everything about my patient.
Wow, that's perfect.
Yeah.
Okay.
I would like if you can also say about the conditions where patients can go to hospital and they don't need to go to the term, because there are about 12 cases.
I think 12 or 14 cases that you can go to the hospital without getting a referral. For example, if you're in labor, if you have a foreign body in your eye, if you broke your arm, if a suicide, God help me, 14 reasons, I don't remember all of them.
Heart attack.
You can go.
Seizure.
Yes, a heart attack, seizure, a sepsis, yes,
burning,
a lot of
burning,
burns, but only from second degrees and on, not first degree.
Yeah.
Yes, between 12 to 14 reasons why you can go to the hospital without being without a referral. But
exactly.
Imagine you have fever 40, and as I said, you're a young man unable to be at home with it. You can call the nurse a number, which is *2700, and ask for a referral. And this referral can be good for the next 4 or 5 hours. So basically, if you cannot manage to treat yourself at home with the nurse's advice and stuff, you can ask for a referral and they will give it to you.
I believe, is it true that there are a small or a few cases that you can go to the emergency room and you have 24 hours time or 48 hours time to bring them the Tofesh 17? Is it true or not? Or I'm confusing with something
I think it was in the past.
Okay.
I'm not sure it's today. I don't want to give you false information. Okay. I remember in the past, within 24 hours, we could give a referral. Yes. But I'm not sure it's applicable today. Please, I can check for you, but I'm not sure.
Guys, any other questions for Shlomit, for us?
if it would be possible to make some kind of PDF, the small presentation of all those 14 cases when you can go to the hospital without going
Yes.
to them.
So
Yes.
yes, we
Yes.
can
I will
prepare
send.
that.
14 מקרים שמותר ללכת.
I think you have like it exists in the Klalit.
I have it.
Like
I have
a
it somewhere. I will
promotional-
bring. And guys, good luck to you. And welcome to Israel. I mean, seriously, this war
Thank you.
is a great opening for you guys.